Welcome to this short training video based on the HEE assessment strategy, which is available on the website. This video provides a brief introduction to the Supervised Learning Event tool, the direct observation of practical skills, shortened to DOPS. A DOPS is used to assess the trainee's practical, procedural, process-based skills when providing contribution to care activities. It enables supervisors to provide feedback to the trainee to help them further develop and refine their skills. In the assessment strategy, DOPS is one of the assessment tools that can be used to record an assessment activity. The assessment strategy indicates which assessment activities could be recorded using a supervised learning event. Supervised learning events, such as the DOPS, are a formative assessment, which aims to provide trainees and supervisors with the appropriate information to facilitate and enhance further development. They will also support the provision of evidence that will contribute to the demonstration of the learning outcomes. A DOPS can be carried out in any patient care setting, such as the dispensary, on a ward, in consultation rooms in the pharmacy, in general practice, in care homes, or in outpatient clinics. Some can be done away from direct patient-facing settings, such as in an office, an aseptics department, or a medicines information department. This slide provides some activities that could be captured using DOPS. This list is not exhaustive. It's important that the trainee should have received training on how to undertake the activity prior to attempting it as part of a DOPS. Trainee pharmacists may not always be expected to succeed in a procedure, particularly if it is their first attempt. For example, taking down all the relevant information when receiving a medication information inquiry. It's important to set the expectation of the trainee prior to the DOPS, and if they do not succeed, further discussion highlighting alternative strategies and how best to ensure success in the future needs to be included as part of the developmental feedback. It is very important to reiterate that not succeeding in the task does not equate to failing a DOPS. You cannot fail a DOPS as they are formative and add development. It's important to remember DOPS focus on trainees undertaking activities that adhere to strictly defined protocols. The DOPS form is divided into two parts. There is a table of criteria which provides guidance for the supervisor and trainee on the different knowledge and skills that may be observed during a suitable DOPS activity. And there is an area to document details about the scenario, the developmental feedback and action plan discussed after the supervised learning event and trainee reflection. The DOPS has criterion prompts to assist supervisors during the observation of the trainee. There are 11 criterion within the DOPS which focuses on the trainee's ability to undertake the activity being observed. It does not test the attitude, knowledge or behaviour of the trainee. For some of the criterion, the DOPS forms provides prompts for clarification to assist the supervisor and trainee. For each criterion, the supervisor can choose to grade the trainee at below expectations, meets expectations, exceeds expectations, or not applicable. Meeting an expectation is based on professional experience and judgment, and so will be subjective to each supervisor. It is strongly recommended that the supervisor sets expectations with their trainees prior to undertaking any of the SLE tools, including at what level their expectation is. For example, they may choose to set their expectation to the level of a day one registered pharmacist, or they may choose to set it at the experience of a trainee at that point in time of training. This will have an impact on the rating scale of the trainee, but should not impact on the action plan and developmental needs of a trainee. It is expected that in practice, some scenarios will not provide opportunities for all criterion to be met. Therefore, the not applicable should be used and should not impact the overall assessment of the trainee. Trainees and their supervisors should use the developmental model of feedback, which is designed to encourage trainee reflection. This is covered in the Introduction to Supervised Learning Events video. Please refer to this video for further guidance. Once the feedback has been discussed and the trainee has confirmed that they clearly understand it, the trainee and supervisor should form an action plan to capture future learning goals. This is covered in greater detail in the Introduction to Supervised Learning Events video. Please refer to this video for further guidance. This slide provides an overview of the DOPS process and time required. Estimates of time will vary dependent on the trainee's supervisor confidence in the activity being undertaken and their familiarity with the DOPS process. For further information on the SLE tools, please visit the HEE website. A more detailed e-learning module on pharmacy DOPS is available on e-learning for health. The link to the training is available in HEE Trainee Pharmacist Foundation Year Assessment Strategy, available on the HEE website. For further information on the learning outcomes, please visit the HEE Trainee Pharmacist Foundation Year Assessment Guide and Strategy on the HEE website. This describes the assessment activities, which as a whole are designed to provide a range of evidence against each of the learning outcomes. There are also many other additional resources on the HEE website. For more information, particularly on the learning outcomes, please do look at the GPHC Foundation Training Manual on the GPHC website.